Hello and welcome to the latest edition of Here for Good, where we explore how transformational leaders create a positive impact on the world around them. Throughout history, inspirational leaders and organizations have always used the power of words to connect with emotion, galvanize communities, and enlist others in causes for change and good. At Virtua Health, we are changing the way people think and talk about health and well-being. So it is our privilege to tee up meaningful conversations with engaging social catalysts and thought leaders. Please welcome our host, Dennis Pullin, President and CEO of Virtua Health, as he sparks today's exciting conversation.
Today's episode for Here for Good is truly a special one. Not only is it the first one in which I have an opportunity to hear from not just one, but two transformational leaders. And my guests today also happen to be individuals I once called boss, then colleagues, and now two of my closest friends, Ken Samet and Jack Lynch. Jack has served as president and CEO of Mainline Health since 2005, providing executive leadership to suburban Philadelphia's most comprehensive healthcare system. Mainline Health is comprised of four of the region's most respected acute care hospitals, as well as one of the nation's premier facilities for rehabilitative medicine. In addition, one of the leading addiction treatment programs in the Northeast, as well as a home care and hospice division and an institute for medical research. Jack, welcome to Here for Good.
Thanks, Dennis. Looking forward to the conversation. Appreciate it.
Ken Samet is the president and CEO of MedStar Health. With more than 35 years of experience in healthcare administration, Ken provides strategic oversight and management for MedStar Health, the largest healthcare provider in Maryland and in the Washington, D.C. region, comprised of 10 hospitals, a comprehensive network of health-related businesses that includes ambulatory, urgent care, home health, a large multi-specialty physician network, and an insurance product. MedStar Health has a large research and innovation platform and one of the largest graduate medical education programs in the country. Ken, welcome to Here for Good.
Good morning. It's nice to do this with both of you. Look forward to it.
So there's a lot that I'd like for us to talk about today, but obviously we're limited on time. Really want to focus on a couple things. Perhaps your path to leadership, some of the business and economic issues that we're dealing with in today's environment, and just a whole host of things, including the COVID pandemic that we're dealing with. But I really want to go back to the beginning. And Ken, I'll start with you. Let's talk a little about the early years. I know you didn't just wake up one morning and decide you wanted to be the second best CEO in the region. What got you started in this?
Well, I'm trying to decide what the region is so I can understand that question, but I'll move from that. It's an interesting question, and talk about it a lot of times for all of us young people say, well, can you connect the dots for how you got where you are? And I always say, well, it's very easy to connect the dots looking backwards. Looking backwards, I get it precisely right. Looking forward, actually, that's not the way that I thought the dots would connect. And it speaks a lot to moving at moments and putting yourself in those situations and having the courage to take whatever that next step is for you. So for me, I was pre-med for a bit because that's what my mother expected. And I loved the medicine, but it didn't love me. And so anyway, I became a business major and truly on a fluke, took a healthcare finance elective class in my junior year in undergrad. It was taught by a local hospital president and his CFO. And as soon as I was in that class, everything connected for me. They were talking about medicine, but in the business of medicine, the organization structure, how you put people in a situation to do their best. And that was the beginning. If I don't take that class, I never knew there was such thing as a non-MD healthcare administrator. So from there, the dots started to connect.
Yeah, you mentioned non-MD. So Jack, I had an opportunity to work with your dad, who was a well-respected physician at the Washington Hospital Center. So I imagine growing up in a household that was surrounded by medicine perhaps had some influence. Was that a driver for you to sort of choose this career path?
It was in a little bit ways, Dennis. I learned earlier on that medicine wasn't going to be for me. I looked at the hours that my dad was working and pouring into his job, and I thought that added with the academic challenges of going to medical school, I really had a passion for business. I was fortunate enough to join the Bethesda Chevy Chase Rescue Squad at age 17 and a half. Probably about 18, maybe 18 and a half. I was really fortunate to go to work at the Washington Hospital Center as in the original MedStar unit, the medical shock trauma and acute resuscitation unit. And so I very early on had the opportunity to experience the delivery of healthcare both on the street and in the emergency department. And while the medicine was exciting and I enjoyed that piece of it, I really enjoyed the logistics of it. And back in those days, it was the battle between Maryland and DC and the helicopters. And we, as the rescue squad, we did care in both Maryland and DC. And so the politics around the delivery of healthcare as as a young guy, I'm like, this is crazy. And so I went to University of Scranton, studied management, went straight into graduate school, and then came back and did four summer internships at the Washington Hospital Center. In fact, I tell people all the time, I gave Ken Samet his first tour of the Washington Hospital Center.
And the place hadn't been the same since, right?
Exactly.
I think we both worked on a laundry project when we first got there.
We did indeed.
The one thing I will tell you both, and I want to do this early on, my dad spent 50 years at the Washington Hospital Center. And I can tell you every administrator that he didn't have fond feelings for, and I can tell you every one he did. And he always talked about how the two of you got it, that you both understood medicine, you both understood the importance of the delivery of care that your institution was responsible for, and you got doctors. And so to grow up in an environment and be colleagues of the two of you and watch the two of you with the medical staff at the hospital center has been a real inspiration for me.
Both of you mentioned early on. So I recently had an opportunity to participate in an interview with the Journal of Healthcare Management. And one of the questions they asked me was they wanted me to name some of the people who have helped to shape my management style. And obviously it comes as no surprise that sparked or created an inspiration for today's discussion. But I also thought it was an interesting and important question. Particularly in today's environment with COVID and racial injustice. I'd like to just tweak that a little bit and ask the question a little differently to the two of you. Perhaps you can explain a little bit about your management style, but then more importantly, has that changed at all because of what we've been going through in the last few months? So Jack, maybe if you could take a stab at that first.
Dennis, I would say growing up in Washington, D.C., I had a real appreciation for the fact that I was privileged, that I had a lot of things going for me. I went to a great high school. I had the opportunity as the son of a doctor to work in a hospital at age 18. Really early on in my career, got exposed to things that a lot of folks don't get exposed to. So that led me down the direction of becoming involved in the Institute for Diversity in Healthcare Management very early in my career. I've had countless summer interns from the Institute for Diversity. And I would say that's probably where I learned the most about the differences that someone like me versus someone like you experiences in healthcare leadership. And then as I started to rise in the ranks and I started to look around, more and more of the people that I was working with looked like me and Ken. And I became very frustrated with that and became committed to trying to diversify the leadership group that I was working with because I knew we'd do a better job at delivering the care we're expected to provide if we had a diverse group of people around the table. So that's sort of where I came to understand the importance of it. And then quite frankly, my friendship with you, we have had conversations, 20 years ago that would have been considered forbidden back then. And today, they're the conversations that a lot of people struggle with. I've got 20 years of insight from you about what it's like to be a Black man as a significant leader of a health system and coming up in a health system. So those kinds of experiences have really had an imprint on me.
So would you say that they actually having an imprint on you, but actually impacting the way you manage or your style in terms of dealing with not only a diverse and inclusive culture, but just from a leadership perspective?
Yeah, you talked about mentors early on. I've had some good ones, and I would put Ken in that bucket. A good friend of all of ours, Doug Shepard. But those guys were, looking at the world in a way that we're here for everybody, and particularly when you're delivering care in Washington D.C., you've got to be there for everybody. And so I think that what I was convinced was that I get up and put my pants on the same way everybody else does in the morning. I got stopped early on when I got here at Mainline, and director of security stopped me in the hall and said, "Mr. Lynch, where's your badge?" He didn't stutter. He was just very nervous. I said, "Well, Jeff, I'm the president and CEO. I don't need to wear my badge." This poor guy looked at me like, "Oh my God, what is this?" I said, "Jeff, you will never ever see me without my lanyard on ever again. I'm no different than anybody else in this institution." And I think when you have that orientation, and I know both of you do, when you have the orientation that you're not better than anybody else, you just have a different set of responsibilities, that causes you to think and act differently. And I think that helps me along the way.
So Ken, we all talk about a lot of the lessons that we learn from working with good good people, and I think all three of us have been very fortunate to work with some great mentors and have individuals that really provided us with a lot of positive examples. But that's not always the case. Can you reflect back on perhaps a lesson you learned from maybe one of the worst bosses you've ever had?
So maybe I'll tie a few themes together on that. So I think the lesson from bosses and other leaders we've all watched that I think we should all remember so that we don't do it is it's not about you. And I think that's the biggest takeaway for me for where bad leadership starts. Because when people think that they're in the role, they have a title, and somehow playing off of Jack's comments, that makes them smarter, better, more entitled than everybody else because it's about them. The organization absolutely suffers from that moment forward. And I've seen situations like that. We all have within organizations. We see it in our country at times, even today. And so I think if I connect that back then to my leadership style, what I hope it is, and how it connects to the crisis, to your question, I feel like I'm very open, transparent. I want to say informal because I think that the work we do is so serious, but we don't have to take each other seriously. We have to be respectful, but we have to create an environment where everybody feels that their voice is equal. Eventually, we'll make a decision as an organization, and sometimes you have to make that from the top. But if you're just sending a memo from your office and saying, the king said this, the queen said that, that actually doesn't cause an organization to perform. And so at this time of crisis, I think we benefited because we built a team-based approach, an open, constructive approach to how we make decisions and how people take responsibility. Because as you all know, this pandemic came fast and furious, and it required the organization to be comfortable breaking down walls and people making a series of decisions that were critical on the moment, in the moment. Well, if you have an organization structure that cascaded leadership, people were comfortable they could do that. They could ask for help when they wanted. They could jump 10 levels of the organization and send an email to our chief medical officer or our COO or me and know that that was okay. And so I think it actually helped us in this time of crisis because you had that culture. The other reason I think it helped us is if you're that kind of a leader, as you all are, you attract better talent because really good people want to be able to contribute. That means they need to be able to be turned loose. And if you're really a command and control top down, it's all about you in today's world. I think you only keep the players that can't function without that. And the organization, again, doesn't perform.
And it makes you not very approachable as well.
Yeah, two comments I'd make about what Ken said. One is A players hire A players, and B players hire C players. And I'm most proud of my team because they're smarter than me. And I know that that's true in both of your cases. Your teams are smarter because we're smart enough to hire really, really good people. The other word that Ken didn't use, but he described it to a T, is empowerment. If the only way you get things done in an organization is because the CEO says it's okay, you're not going to survive. And in all of our organizations, I know that we've empowered people, and our teams have empowered more people to do the right thing. And doing the right thing in healthcare will never get you in trouble.
So Jack, one of the most challenging parts, I think, of being a leader is how people interact with change. And clearly, as you both mentioned, 2020 has certainly brought about a lot of change for all of us. I think as a leader, what's been the most surprising part of navigating through these uncertain times? And I'll pose that to both of you, but Jack, since you have the mic, maybe you can answer it first.
So again, I'm going to go back to my dad. He taught me early on that doctors don't mind change. They just don't like to be changed. And the lesson there for me was, if you engage with your medical staff, if you engage with your employees and your leadership in the decision-making process, it may take you longer, but you'll likely make better decisions. And more importantly, you'll likely get adoption. So one of the things in the pandemic, and again, I've watched both of your organizations deal with this, and I think you've done the exact same thing, is when you're doing something to the organization that may not feel good, may impact people's lives, when they don't know why we're doing it, it's not good. And so one of the things that we've done well, I think, during the pandemic is really explain the why behind the decision. And I don't know that we've always done that well, but it became very clear to me when we were making very difficult decisions, canceling elective surgeries, impacting people's lives, sending people home. They needed to understand why. And once they understood why, they may not have been in agreement, but at least they could, as Ken said earlier, they could connect the dots as to why management was making the kinds of decisions they were making. So the why in the change for me is a real key.
So Ken, would you agree? Would you agree from looking at one of the most important characteristics of a leader during a crisis, to Jack's point, is about the clarity of communication?
There's just no question but that communication, number one skill set, number one requirement. And no matter how much you communicated, to Jack's point, you weren't communicating enough. You thought that you didn't want to inundate folks by giving them communication every day, when in fact they needed it every 3 hours if there was something moving, changing. People needed to know their whole life was in front of them, both on the units and how they went back home. So it's communication, but it's also, I would say, it was being real, being in the moment with them, communicating not to just make it all okay, because it wasn't okay. So, but to communicate in a way that shared with them what we were trying to do to deal with the really hard issues, to let them see when we didn't actually know what the answer would be tomorrow, because we haven't been through a pandemic before. But here's the things we're going to focus on, and here's what, as we called it, here's what our true north was going to look like. And the one thing I'd say that was maybe a little surprising, but I think I'd rather just say that's different than the normal reaction to change. As you move down, leave the medical staff, and at some level, leave the frontline folks. Typically in leadership, the biggest challenge for change is in that middle management level, where folks are coming up in their career, they have departmental responsibility, which department's responsible for what. There's just a lot that goes behind that. And even though we might talk about one MedStar, there's different ways people see that. The issue in front of us on this pandemic, the cause, the purpose, was so big that everybody was all in. So when we talked about canceling electives or how we were going to stand up telehealth, people ran to the fire. They ran to do something different. Nobody cared what their title was and what they had to do. And it was really rewarding to watch. And I think for all of us, for every leader out there, if we can figure out how to bottle some of that, to Jack's point, keep some of that when we get back to normal, that'd be really good.
Ken, I actually have a term. Let's make our decisions like COVID did, and let's COVIDize the decision, because I look at the deployment of our telehealth. We were doing very little before.
Right. Yeah.
We did 50,000 visits in a couple months, just like that. We never had anybody working from home. Within a week or two, we had 1,500 people deployed with laptops. Right. I'm saying, how do I bottle that energy, that commitment to change, and use it post-pandemic?
One thing though, Dennis, I just need a different term on that, because COVIDize, I have so much post-traumatic stress right now. I can't use that word, but I'm with you on what you're trying to do.
We'll Sametize it.
No, we don't want that either. But Ken, you mentioned something about change. And did you or have you done anything in the past several months in your job that you never imagined that you would be doing?
One jumps clearly off the page. I am now a certified junior supply chain, I don't know if I can say expert, but from unloading trucks to 24/7 back in the spring, even as you had PPE, you were worried that you didn't have enough. And we figured out that at 11 o'clock at night or on a Saturday, if the CEO was part of the team making phone calls through brokers to somebody else that you never dealt with, who said they're in China, but who knew? But when you found those moments, having the CEO there to make an organizational commitment mattered. And and it was a way to contribute, because at some point, the heroes are on the front line, and the heroes are those that are supporting those on the front line. And all of us, from a mission standpoint, I'm trying to figure out how the suits could actually contribute. But that, I will admit, after the second truckload, it just happened that we had people down, so we jumped in and helped a few execs. After unloading the second truck, I realized that was a young person's game, and maybe I wasn't that good at that.
What about yourself, Jack?
A couple things. One, I think the importance of rounding and being visible. We put people's lives at risk every day, pre-pandemic, post-pandemic. The whole violence in healthcare is real, and what our staff experience in encountering behavioral health issues with patients, dynamics of family. So you remove the family from it, and now you've got an even more stressful situation. So being visible in the care environments in a time of the pandemic, I think, was not something foreign to me. I used to do it. I did it pre-pandemic, but I found it to be even more important. When I walked down a hall of an intensive care unit wearing a mask and eye protection, that showed that I wasn't afraid of the challenges that I was placing our staff in, recognizing I was not nearly as potentially exposed as they were. So that was one. I think the other surprise for me, and both of you know this about me, I like being in charge. And if I've got a command center set up.
That's an understatement, but yeah, go ahead.
Well, I had to be with you. When I had a command center, I had a command center set up, and I figured out, what, my team is going to do better without me in the room, because if I'm in the room, they're looking for me to make the decision.
Yeah.
And the decision will be better if I'm not. So I created 3 teams that worked 3 days in a row, never crossed over each other, and I was in the background. And I found it to be incredibly empowering and incredibly helpful, because, quite frankly, all 3 of us are pretty good at what we do, but we're not experts at some of the things that you need to have experts making the decisions. And in fact, making the presentations. So unlike what we're seeing sometimes in the federal government, I had no problem with one of my team members being the expert that was communicating with our team about what we needed to do. It comes differently when it comes from the expert than if it's translated by one of the 3 of us. Now, again, I think all of us play an important role in that communication process and that leadership process. But I was proud that I was able to back away and watch my team do what they needed to do and be there to support them when they needed me.
So I want to switch gears for just a little bit and go back to something, Jack, you touched on in the opening. That's diversity in the leadership ranks in healthcare. I mean, we all know it's a challenge. I think both of your organizations have done a phenomenal job in really promoting and advancing women and people of color. Jack, at Mainline, of your 5 hospital presidents, 3 are women and 1 of color. Your chief operating officer is a female. Ken, MedStar has been an industry leader. I think when you look at your corporate structure, not only is your COO a female, your chief financial officer is a female, your general counsel is a person of color. You got many hospital presidents that are females and people of color. It's been a challenge in healthcare. I mean, as an industry, outside of what the 2 of you are doing, do you think we're making any gains? I'll kick it to you, Ken, first, and then Jack, I'll ask you to comment as well.
So I appreciate the setup to your question, but I'm not going to answer it on behalf of just the industry outside of us. I'm going to throw MedStar right in there, because I think that the bar was so low that we could frame this and make it look like we actually have made progress. And so, sure, we've made progress against the historical norm, but we are truly nowhere near what we ought to look like from a broad diversity standpoint, given the nature of both who we serve, and as Jack said earlier, how much better we'll perform if we have a diversity of talent and thought and experiences helping us make complex decisions. And as we all know, healthcare is as complex as it gets, because what comes to us in our healthcare systems is a reflection of what is in our communities, our regions, and our country. So every issue we have, we're part of. And so how do you solve that if you don't have a sitting in your organization, the breadth of those thoughts and the diversity of that talent? So with that said, I think we've made progress, but I'd say this: we have to be so much more intentional as a field, as Ken Samet, as MedStar, so much more intentional about what we're trying to accomplish, when, and how we're going to do that. Not so the first two slides feel like the right thing. Yeah, sure, we're doing that. But how will it translate? And one of the areas that I think for me is, the diversity of talent inside our organization as we move through middle management and the like, and a host of our Leader of the Future programs is tremendous. And so what are we doing from a leadership development to be intentional with these individuals so we help them advance inside MedStar? They know our culture. We don't always have to go out trying to find what's special on the outside. And it's there for us. And that's the long-term pipeline. But let's be, when I say intentional, people have to know you're intentional. So let's take the risk, show that leadership moment, put a stake in the ground that people can then hold our organization accountable for. And I think once you get the hydraulics, as I often talk about, as you've heard me say, this is a long-standing issue, and it's not an overnight solution. So it's like turning that battleship. But when you get the early hydraulics right, the momentum on this will be so significant. And when our time's done and we look back, I believe this will be some of the legacy work that we'll be most proud of.
Yeah, and I like the fact you used the term intentional. I call it purposeful, things that you are doing by design. Jack, your thoughts on it?
Yeah, I would echo Ken's comments. And the good news is, I know for a fact, having been around MedStar and the Washington Hospital Center and being in the market next to Virtua, this didn't just happen post George Floyd. This work has been going on. We just celebrated our 9th or 10th Disparities of Care Colloquium. So same with you guys. We didn't all of a sudden wake up and decide, oh my gosh, we have made a big mistake, we need to make change. The fact that we're not where we want to be, I think underscores how challenging this is. Ken's point about developing the internal talent couldn't be stated even greater. In fact, I now know where to get some talent that I need because Ken's doing a good job internally.
He's developing it for all of us, right?
But the problem, Dennis,
I sent you Dennis, and you just let him stop a little geographically distant from
Excuse me, I sent you Dennis.
Okay, can we not fight about Dennis? And just...
We're all going after the same talent. I'll tell a short story. I was in a management forum meeting, probably 200 or 300 people early on in my career at Mainline. And I looked out and I was really moved emotionally with how bad things were. I looked out and I saw mostly white people. And I literally, unscripted, which can be difficult sometimes for people who are listening, I said, you know what? I'm really bothered. We've been talking about diversity for a couple of years. And I look out in this room and we don't have this room representing this community. And I said, going forward, and everybody's like, what's he going to say? Going forward, we will not hire a manager or director or an executive without a diverse candidate pool. And it kind of glazed over and looked at me, and the HR folks were like, oh, what does this mean? And afterwards, I was amazed at the response I got. The white people were angry because they didn't believe they'd have a growth opportunity at Mainline Health anymore because Jack just said, we're going to have diversity. And some of the African Americans in the room, feedback I got back was, oh, so the only reason I'm here is because I'm Black. And I didn't say either one of those things, but it goes back to Ken's point about the importance of communication. You can't say it once, and you better be clear, and you better say it multiple times, and you better do what you said you're going to do. So I'm really proud. We have, and I use a different word than both of you used. I use surgical, and it's really for me, it's even exponentially beyond where intentional is. You got to be surgically intentional about having a diverse team, or you're not going to get there. And intentional may be enough, but I tell our folks, if you're going out recruiting, we need to be looking in different places than we've looked before, and we've been successful at it. And it's hard. We're not where we need to be, but like the two of you, I'm absolutely committed to continue to be intentional, starting with the board and moving through management, so that our leadership team from the board down looks like the community we serve.
Now, does either of you have a program by which you extend that throughout your entire ecosystem in terms of vendors and people that your organization actually do business with? Do you add that as an element of the sort of review process to make sure that you either have an organization that is owned and operated either by females or people that are considered to be minorities?
Yeah, I'll pick up.
I'm sorry, Jack, please.
Yeah, I'll pick up on that. I don't think we've been as good as we need to be. We've had a goal for leadership for probably the last 5 to 7 years about the diversity of our spend. And historically, when we talk about the diversity of our spend, I think we talk about our supply chain, and we've really opened it up to lawyers, accountants, IT consultants. The full spend, we want to look more diverse than it did before. And we're working with the Chamber and the African American Chamber to really get into those communities so that we know where those resources are available. We're not where we need to be there. I would say that they're in the construction space, and we've done over $1 billion worth of construction in the last 15 years. I would say we've been very intentional there, requiring, it's always easier to require somebody else to do this, requiring our general contractors to have a diverse workforce of a certain percentage.
What about yourself, Ken?
I think Jack's answer frames pretty much where MedStar is as well. The supply chain area, the construction areas, we're very intentional there, and I think there's real opportunity to make a difference there. I think, as we all know, this space is evolving, not just for organizations like us to be intentional. It's actually evolving, and for whether it's the chambers or the actual city administration, for all the areas we're trying to help to do this, there's a responsibility on the other side as well, because we're big organizations. So we need talented minority-led, minority-owned organizations to be able to deliver that work. And we've all seen examples where you thought you were doing that, and as it really turned out, that small organization wasn't structured right to either do the work, or they passed it on in different ways. That only looked good for the moment because it let us fill out a form and tell the mayor that we did a certain amount, but it didn't help build lasting legacy underpinning. And for me, that's really what's behind this. We're such big purchasers and we're such big drivers of economic engine. And the only way to get communities ultimately to all be healthy, and I'm sure we'll talk about this a little bit, relative to the health of a community, socioeconomic issues are critical to that. And so these underlying businesses that we want to do business with, we need them also to be successful so they can hire more people. People have economics. We have a chance to then get to healthcare.
So Ken, let's talk about that for a second. So healthcare systems across the country are experiencing our own struggles as the economy take a hit as a result of the pandemic. So talk to me a little bit about, the hardest lines we have to walk as healthcare leaders when we are trying to balance, or the art of balancing business and economics with, staying true to our hospitals or health systems mission. There is some difficult decisions that have to be made.
Well, I think those decisions were placed on steroids for every healthcare organization during COVID. I mean, and we are during COVID, where this surge is very significant as we do this discussion today. So the single biggest financial crisis in the history of America's hospitals, without question. That being said, I think that it's also at those moments when you make a statement to your organization as to who you are and what you'll be for the long term. And then once you say it, you better actually believe that. So at MedStar, back in March when this happened, when COVID first happened and it was clear what the impacts were, we stopped blunt stoppage in our area on the 17th or the 15th of March of all elective cases. 2 days later, I came out with a statement to all 30,000 folks, and I talked about our true north was going to be people first, our patients and our associates, and then financials. And I actually said, sure, you think that's an easy thing to say, because which leader wouldn't say that? Except because it's the single greatest financial crisis, actually living that statement is going to be so much more difficult than you hear it. But we actually did that. And I'm proud that we had to have the board totally engaged. We had to communicate at a hard level. We managed the things we could manage hard, controllable expenses and a host of things aggressively. We managed revenue. We did a lot of things. But through the entirety of COVID to this day, we didn't do any broad furloughs. We didn't lay anybody off. We just gave out full merit increases. We're a June 30 fiscal year when other big systems and hospitals in this area are holding things flat. We didn't defer their retirement match. As you all know, these are all big dollar issues that would be helpful right now. And we didn't actually know how the CARES Act would happen when we made that statement, which has been helpful, perhaps not as helpful as it could be if we could get all that lined up. But we stuck to that. And so I think it was the right thing to do at a time when we're asking our people to be heroes in ways they never have, to put themselves at risk. And then selfishly, from a business standpoint, I hope over time that people will remember that, will think that this is a good organization to be part of, because recruiting and retaining talent is our biggest challenge completely. And I made one last comment on this. We also made a decision, given what happened to the physicians. We told our physicians that we would hold their income flat. So if they're an RVU-based, productivity-based physician, and a lot of them, obviously their world stopped. You know, their surgeons, they stopped. We held them flat. We ended up doing it for 2 full quarters. The entirety through COVID, the only thing we asked of them is, we're going to redeploy you. You'll be sitting on a telehealth call desk. You'll go into the ICUs. You'll do whatever you have to do. At a time when that wasn't the case here. And especially then when you come back to business, we're already seeing our physician recruitment from other organizations happen in a positive way. So to your question, it's the right stake in the ground, I felt, and that was where we were gonna make our hard, honest stand. It was right for our people. And then back to business, I actually think it's gonna have long-term positive impact. It definitely cost us money in fiscal 20, no question.
So Jack, healthcare has changed tremendously since we all started our career. And I think one of the biggest challenges has been needing a wider focus on social determinants of health. You know, something I believe as healthcare leaders, we all need to address when it comes to social determinants of health. What do you think as a region, as a country, that healthcare leaders either have been doing well or we could do better to improve the overall situation?
You know, Dennis, I think the pandemic has really underscored the complexity and the seriousness of that problem. I mean, you don't have to go very far to see that the Black and brown communities have been adversely affected differently than the white community. And first early on, I asked, is this a genetic issue? Is it like a sickle cell or Tay-Sachs, where there's something about your genetic makeup that's causing that? And all the information I've been given is no, it has nothing to do with that. As you said, it's all about social determinants. How sad is it that your zip code is one of the single biggest contributing factors to your life expectancy? That's a problem. I provide services on the border of Montgomery County, Pennsylvania, and Philadelphia County, the 67th least healthy and one of the top 2 or 3 healthiest counties in the state, literally across the street from one another. And so I think being aware of that. So I'll tell a story. I reached out to a good friend of mine in town and said, do you think your CEO believes there's disparity of care in your emergency department? He said, no. I said, do you believe? He happened to be African American. I said, do you believe there's disparity of care in your ER? He said, yes. And that was a real aha moment for me, because for many years I've been told by some people that, we got a bunch of white leaders in healthcare that are racist. And I just didn't believe that. What I concluded from that statement was, we've got a bunch of leaders in healthcare that don't understand the disparity of care that's going on in their walls. And if they knew about it, they'd be all over it. So I think one of the biggest issues around the social determinants of health is we've got to understand what those social determinants of health are doing to our communities, and what we're doing internally and inside our walls and outside in our practices that are contributing to that continued disparity of care. So I think one of the most important pieces of this work is the metrics. Are we measuring the differences in how one population is experiencing care versus another population? We're looking right now at the gap between readmission rates between Blacks and non-Blacks. I don't know if it's good to be up or good to be down, but there shouldn't be a gap. We're currently looking at the gap between postpartum hemorrhage, between Black and brown and other. And again, I think when you start turning a lens to those gaps, we'll make progress.
You know, Jack, you said something that I have to comment on. I think some of it also historically has been the arrogance on some of us as leaders, thinking that we knew exactly what the community needed or what we should be providing for the community, as opposed to listening and let the community also speak. We all do our community needs health assessments every so often, and the community speaks to us, and it's incumbent upon us, to your point, to listen and then plan accordingly based on what the community have either told us or demonstrated to us where the needs are. Ken, would you agree
Yeah,
or
so
disagree
let me
with
jump
that?
in and kind of come at this to get to the same outcome, but in a different way. So I think this is also an example of you get what you incentivize or you structure organizations to do. So let's go back to our careers. 3 fairly, I hope, enlightened leaders trying to do the right thing. So if I pick on me, I've been in Washington, D.C. a long time. There's never been a day we didn't try and provide great care to everybody. Proud of it, right? You both walk those halls. And yet we have third world health statistics for infant mortality in Ward 7 and 8. I got 30 years of a failed career then. But yet I know we did really great things. And here's when you think about the big change and why this is a different moment. What I know for certain is that we provided the same great care to every Black, brown, white woman when they came into the Washington Hospital Center. For their 4-day length of stay, same care, same doc, same nurses, same everything we had, no pocketbook biopsy. But I just defined it as our 4 days. And by the way, that's what we got paid for. And that's all the resources we had. And public health, DC, other people had the rest of their life. And we had, if we were lucky, a 2% margin. So in some respects, that's where we were. And the community needs assessments, Dennis, that you talked about until the Accountable Care Act. And I talk about this a lot because I think it gets lost in the discussion. I think it could be, after covering pre-existing conditions and a few things, one of the most important things in the Accountable Care Act. The old community benefit reports we all did just added up what you did. Gave $5,000 here, I did this, I did that. All neat little programs, not intentional for an outcome. They added up to a chunk of millions of dollars. There we go. We did it. And then we have the world as we have it. Now the community needs assessments don't let that happen. They actually, as you all know, to your point, we have to say, what are we going after for that community to make a difference in health outcomes? And the only way we can actually do that, we can't do it in the walls of our hospitals or in our distributed network. We need partners. We need churches, barbershops. We need schools. We need local community leaders. And we were these big organizations. So we didn't spend time talking to little mom and pop shops or the little local, because we knew it all. And we were so big, that wasn't the kind of organizations that you hung out with. All of that created then the outcomes that we've gotten. And so now, just to finish this, now you sit and you start talking about value-based care. But more importantly, the reason you mentioned we're in the insurance business, we've been in Medicaid in the state of Maryland, we're in Medicaid in the district. We have 180,000 Medicaid enrollees in our insurance plans today. The reason that that's important is we now get an opportunity to structure care longitudinally because we have resources and we can put them to work in ways that change health outcomes, not just to be waiting for the Medicaid enrollee to show up on our doors. All of those pieces, intent and structure, resources lined up. And yes, we then, as the big healthcare systems, we have to own that outcome, but you won't change it if you don't also change the underlying structure.
Before you go, I want to just piggyback a little bit on Ken's comment. The other piece is the accountability. So the 2 metrics that I measured, the postpartum hemorrhage and the gap in readmission rates, those are on executive compensation plans. One is on an annual basis, and the other is on a 3-year goal. So I've got every single senior executive's compensation, incentive compensation, tied to, do we narrow the gap on those two metrics? And that gets people focused.
So Ken, I'm going to try and wrap this up with my last two questions before Jack sends me a bill for his time. But I'll ask you both. What do you love about your job today? Start with you, Ken.
So there's two parts, I guess I'd think about that. The first is I'm as excited and privileged to work in healthcare today as I felt when I started, amazingly, 38 years ago out of grad school. There's never a time that I've regretted or not been so energized to say that I work in healthcare, because of everything that I believe healthcare does and how it matters. And so at this moment, notwithstanding the fact that Jack was wrong, if his decision not to be a physician was based on he didn't want to work those hours, he got that completely wrong.
I was wrong.
Exactly. But when you think about this moment, there's never been a time when our communities needed us more. And there's never been a time when our associates, when our people, when our physician partners needed to see real leadership and needed to get whatever support could come out of our C-suites. And so I think we're privileged. I'm especially privileged to get to do it now. And although I wish I was still 32, the benefit today of having done this now a long time, we bring experiences that I do think are helpful to the organization. And so the ability to get to contribute at this moment, nothing else I'd want to be doing.
Jack, what about you? What do you love about your job today?
The people piece, the leadership piece is, I feel exactly the way Ken does. And that's why the three of us get along so well. I would say the other piece that I know Ken is equally as proud of is when we see people on our teams that came up. So I hired you, Dennis, as a vice president in Houston probably 25 years ago at least.
Best decision you ever made, by the way.
It is. Okay. And then I was a reference for you at the Washington Hospital Center when you joined MedStar. And to see your career blossom the way it has, and for us to be, peers across the river from one another, and to see the impact you're having on your community, that energizes me in a big way. And all of us have a number of people out there. I know, our good friend Doug Shepard, he beamed when he saw all of those people who he had touched their lives in the roles they were in. And Doug would tell you, many of us got beyond where Doug got in his own career. And I think that really made him proud. I would say the same thing. The piece that Ken talked about is also what excites me and ignites me, and that's the leadership. We are in a time now where leadership matters. And leadership is hard, and leadership is making decisions that are not always enjoyed and comfortable for everybody, but leaders have to make those decisions. And good leaders make those decisions by involving, as you both said, listening to others. And so I love my job, and I think about as I walk down the hall, this is business, but it's not widgets, it's people's lives. And it's not only our patients' lives, it's our associates' lives. And we are impacting the lives of our employees every day by the decisions we make. And that's why it's so important. We're making decisions about safety and quality and equity and affordability that impact a lot of people. That's energizing.
So well said. So my last question, which is actually my favorite question, I ask all my guests. Ken, what would your 18-year-old self think about the person you are today?
That's a good question. I think my 18-year-old self would be.
Where did all the hair go?
Well, they definitely think that because it was below my shoulders. And you notice, Dennis, how Jack picked that. I mean, it's not, that's the one thing he has on us. That's it.
Yeah.
I think my 18-year-old self would actually be proud because even back then, my 18-year-old self knew that, wanted to make a difference, wanted to contribute, was still motivated to do well in its broadest definition. And all throughout and even back then, maybe at 18, you were looking for more of the fun days than the hard days. But I always had a recognition that, there was a head and a heart part to Ken Samet. And the head part wanted to accomplish things and wanted to be challenged and wanted to be around smart people and wanted to figure out how to make communities and business different. The hard part, though, wanted to also be able to say I contributed, and that, you know, my mom's proud of that. And so I feel like, you know, from that lens, it worked. And then the other piece is, and it's right here in front of me, looking at the two of you. You know, a lot of people have success and they lose their friends along the way because of how they changed with whatever title they had. And I think the fact that we can have friendships like this and a few others that we all have, they keep you humble. They know you. They don't care about your title. So if they like you still for who you are. And what are your family relationships like? And so I think in all of that, you know, felt all right.
Friends and your kids have a way of keeping you in your place, and you guys do a great job of that for me. Jack, what about yourself? What
You
would
know,
your 18-year-old self?
very similar. I would say at 18, screaming up and down the Connecticut Avenue and Western Avenue and Wisconsin Avenue in an ambulance was pretty cool. But I had a passion for doing something later in life that work would be important foundation for. And so to look back and say that, you know, at 17, 18 years old, I was doing something that I know today contributed to my ability to be effective as a leader is pretty rewarding. Again, I look at the three of us. This could have been a panel discussion on how do you stay within a couple organizations in your career. You know, let's face it, Dennis, Baylor, St. Luke's, MedStar, and Virtua. Ken, MedStar. Jack, St. Luke's, and Mainline Health. That is really, really unique. And so I think to be able to look back at 18 and go, wow, you didn't have to move around a lot of places. Two of us married people that we met in our workplace, both Ken and me, and both our wives worked for the same organization, National Rehabilitation Hospital. So I think that I would look back and say, wow, you did what you wanted to do. I interviewed at Georgetown. The Georgetown interviewer said to me, Jack, if God gave you anything to do, what would you do for a day? I said, be a hospital administrator. He said, what? World Series, Super Bowl, Disney World? I said, I could do all those things. I said, I'm about to embark in 6 years of school, and I'd like to know if that's what I ultimately want to do. So I feel very fortunate. I feel privileged and honored, as Ken described, to be in these leadership roles. And I take the responsibility very, very seriously. But I also recognize that the housekeeper in this organization is just as important in this organization as I am. We have different jobs. We have different responsibilities. But without them, we don't get our job done.
You know, I will tell you, one of the things that I think both of you were able to instill in me is what you just said, Jack. We're all very blessed and fortunate to have the titles of presidents and CEOs, but we understand that our jobs aren't necessarily more important than anybody else's. They're just different. And to be able to embrace the value that our nurses, our pharmacists, our environmental service workers, our accountants, all of our ecosystem bring to the table is truly important. Listen, I can't thank the two of you enough for participating in this conversation. I think what our listeners may not realize that this particular type of conversation that we've had today is a conversation that we have quite often.
Usually over a glass of wine.
I was going to say, usually it involves Ken drinking a lot of wine. But
since you've opened that up, Dennis, how many years will it be until the Cowboys make the playoffs again? I'm just curious.
As I was saying, I was in the process of thanking the two of you for joining me today. And I'm going to ignore that, Ken. This has been really, really a dynamic and engaged, but also an exciting conversation for us to have. The contribution that the two of you have made to our various communities is remarkable. When I thought about introducing the two of you, I realized that I wouldn't have enough time to go over the many accolades and the things that you guys have accomplished. And so I will just speak to the one that I'm most acutely aware of, and that is the impact and influence that you've had on my career. So this is my public thank you to the two of you, and I will never do this again, but I will say publicly thank you.
Is it recorded?
No, for all of the.
Well, just know that we're really proud of you. Seriously, you're making such a difference, and So honored and privileged to call you my friend and colleague. And that'll be the last time I say that as well.
Well, guys, again, thanks for being here for good. Thanks for doing all that you do for this nation. And I look forward to continuing our conversation at a later date.
Terrific.
Thanks, Dennis. Thanks for all you do.
Bye-bye.
Ken, good to see you, my man.
You as well.
Thank you for joining us for this episode of Here for Good. If you liked what you heard, please leave us feedback and share our podcast link with others. Until next time, be well, everyone.